It's time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Good morning. Another great morning of terrific music from Dennis, so thanks a lot. And now here we are with PetSylvania. I'm Dr. Bob from Sylvania Vet, and of course my office is one of our sponsors, so I want to thank us and tell you about our 24/7, 365 pet care destination. It means that we are your full-time pet doctor, but we also do boarding and grooming and rehab and enrichment and instruction for your pets. We do obedience classes. Our 24/7 emergency service is the most fair and reasonably priced after-hours care in the region. Call us anytime. We will always answer our own phone. That's 419-885-4421. Test us. Call us at 2 o'clock in the morning. See if we're there. And just saying, just fooling, just want to know if you're going to answer your phone. But we'd love to have you do it. The staff's awake and working, so it's not a big deal for them to call them. We also are sponsored by Elanco, the makers of once-a-month heartworm and flea control pill called Trifexis, once-a-month flea control pill called Comfortis. And the cool news is that there are some coupons coming in the mail from clients that have bought Comfortis and Trifexis from us last year and sent in rebate coupons. They're going to get an $8 coupon from us that directly from Elanco that you can spend with us on anything you want. I'm sure they'd like you to buy Trifexis or Comfortis, but it doesn't matter. And then I can tell you off the record, now don't tell anybody I told you this, but it's my understanding that rebates of $10 if you buy 6 Comfortis or Trifexis, or $25 if you buy 12, will be coming 1st of March, but they will be retroactive to February 1st. So don't delay buying your product. And then Esplin Medical, the makers of 80% all-natural fiber, bamboo, and cotton surgical scrubs, is also a sponsor. Those scrubs are available online at www.esplinmedical.com. And you can tell I'm pretty tightly involved with that company. The name isn't a coincidence. Or you may in Toledo. I know I have worldwide listeners, so you may have to come to Toledo. But for those of you in Toledo, Toledo Family Pharmacies at Jackman and Sylvania and at Cricket West on Central Avenue stock the Caribbean blue and the navy blue. Esplin Medical scrubs also come in seal blue, which is a nice light blue, and in a jade green, which is a very attractive color. We actually have some people buying these to wear them as pajamas. They are that comfortable. You got to try them. You won't want to wear anything else after you've worn Esplin Medical scrubs. I'm really proud of the product that we've put on the market. I want to talk with you about a disease that I hope we never see. One of the recent broadcasts, we talked about rabies. That's another disease I hope we never see. But the one that I really hope that we don't see is canine influenza virus. It is all over the country. It's been in every state at some point in time. It does not have a season. It's devastating in a population that has no immunity. There are 2 manufacturers of CIV vaccine, and they are both excellent. They both provide excellent protection. All flu vaccine, whether it be the stuff that we take for the flu or it be the flu vaccine that we give to our dogs, are not designed to completely prevent the disease. Those vaccines just are not capable of doing that. What they're really designed to do is to lessen the severity of the disease if you get it, and to decrease the length of time and the severity of shedding of the virus. But if we were to get CIV in the northwestern Ohio area, we would have big trouble because it takes almost a month to establish immunity, and as a result of that concern, it's going to spread and affect a large number of animals, and there is a percentage of the animals that get CIV disease, if they're unprotected, that will die, and many of those that survive will have permanent lung damage. So we want to encourage you to have your pet vaccinated against CIV, and we will be instituting a new vaccine protocol in March or April at the latest that will include CIV as a core vaccine for patients at Sylvania Vet. There's an allergic-like condition that occurs in cats that has this big, long, fancy name. It's called eosinophilic granuloma complex. EGC can manifest itself in a variety of ways. You'll see it in a cat that has it on their upper lip, right in the middle, or and it's looks like an ulcer. And you can have it on the lower lip, right in the middle, and it looks like a raised growth, almost like an abscess, like it's ready to bump. They can get it on the skin, and it can be raw areas that look like abrasions. They can get it in their mouth and in the roof of their mouth, and it looks raw and uncomfortable. I've had it in cats that have had it in their eye, and they can get it on the back of their leg where it goes up and down the length of the leg like little cords. Nobody quite knows the cause of EGC. It's felt that it's probably some form of an allergy, and some people think that food plays a role, but that's not been able to be documented yet. So we're not able to tell. The good news is that it's generally quite treatable with steroids and or with a drug called cyclosporin. The brand name that we would recommend is a product called Atopica. It's one of these things that if you've got a cat that has, is showing evidence of I wonder what that is kind of lesion, I would definitely have it looked at. And many times we have to biopsy these things in order to get a precise diagnosis. And getting a precise diagnosis to whatever problem is going on is absolutely the best way to go, because it gives us the best opportunity to target treatment, not shotgun treatment. It gives us the ability to prognose the likelihood of cure, the likelihood of reoccurrence. So if our philosophy at Sylvania Vet is if it's humanly possible, we want to get a diagnosis. So we are very diagnostically oriented. One of the things that's useful, I think, to talk about, and that kind of goes unsaid in the veterinary circles, is the value or lack thereof of an injection of something. In an animal who's an outpatient and has a problem, and let's just use an allergy as an example, because we see a lot of itchy dogs, a lot of allergic dogs. And so as a result, it's going to take some medication in order to treat that allergy if the itch is really intense. A lot of veterinary practices will give an injection of steroids, either short-acting steroids, prednisolone, or a long-lasting steroid, which I would never give to a dog, ever, and you should always ask. But they'll give an injection. There's really no advantage to that, and the tendency in the profession of giving injections when oral medications themselves will work is what the university professors call injectophilia, predisposition to give injections. The reality is that it doesn't really get a blood level and relief much faster than if you give pills. It's unnecessary. So if we don't have to stick a needle in an animal, the animal's going to benefit, obviously. And you know what else is going to benefit is your bottom line, because you're not going to have to pay for that injection. All you're going to have to do is buy and pay for the pills that are going to do the treatment just as quickly. I wrote down here, let's talk about the BS of buying medications online. And what prompted this was an ad that I saw on Facebook from Pet Care RX and then Pet Med Express as well. And it's sitting there promoting aspirin, dog aspirin, which is really potentially harmful and shouldn't be. It was also an ad for Medicam was right next to it. And I compared our price for Medicam, 10 cc's, exactly the same product. And our price for Medicam was $21, and the price for same on PetRx was $33. That's a pretty substantial difference. If you buy Medicam from us in the sizes bigger than 10 mils, comes in a 32, 100, and a 180 mil bottle, you get a $5 rebate for each time from us as well. You aren't going to get that online. So don't buy stuff online. It isn't really going to do you any good whatsoever. In most cases, you're going to spend more money. So let's take a break, and we'll be back on the other side. Well, we're back, and that was a nice break. So I just wanted to talk to you a little bit about some facts about pets that I think you'll find useful. The normal body temperature, we talked about it last week. The normal body temperature, probably ought to have a quiz here, is in a cat and a dog is 101 plus or minus a degree. Now, it can be elevated a little bit through excitement, particularly in the summer. We'll see dogs and cats looking perfectly healthy and acting perfectly healthy and just fine, and their temperature might be 103 and a half. Just because it's hot outside, they're all excited about being in the office, and so their temperature goes up. The amount of water that a normal dog usually drinks is about an ounce per pound per day. And so that's something that you can look at so that you know if your animal is drinking a normal amount of water or not. The normal dog is going to need to eat somewhere between 20 and 25 calories per pound per day, and that's total calories. So that must include biscuits and table food and anything else. So I want you to concentrate on your dog food. Rough rule of thumb, dog food, dry food has somewhere between 350 and 400 calories per cup. Canned food has about 30 calories per ounce. So you'll be able to kind of figure out, how much of anything to give. If we have to put your dog on a diet, it may go down to 10 to 15 calories per pound per day total intake. The gestation, the length of time that an animal is pregnant in dogs, cats, and guinea pigs, interestingly enough, is 9 weeks. And the number of teeth that dogs have, they have baby teeth, they will have 28. And as adults, they'll have 42. That all the transition from baby teeth to which are called deciduate teeth to adult teeth happens between 4 and 6 months of age. And in a cat, there's 26 baby deciduate teeth and 30 adult teeth, and that usually starts at about 3 months of age with the teeth right in front and goes on from there. So that question about gestation morphs me into a question that we got from Amy, and it says, I was wondering how to wean them off their mother. She says, I have a question for you about my dog and her puppies. I was wondering how to wean them off their mother. What's the earliest I can start to wean them off her milk? Or even when I should start to wean them off, and the best way to do so. I'd like to make them available to go to their new homes as soon as possible, but also healthy. Well, there's a bunch of points there, and I think that the simplest answer is, Amy, for a great deal of more detail, I would encourage you to give us a call at 419-885-4421, and we'd be happy to talk to you in detail about this. Here's the rough rule of thumb. You start the weaning process at about 3 weeks of age. So when the puppies are just 3 weeks going into 4 weeks, their eyes are open, they're moving around, you can start weaning them, and you can use a mixture of mother's milk replacer and baby rice cereal, and then gradually work in some puppy food. And by the time they're 6 weeks old, they should be eating dry puppy food. Puppies shouldn't leave to go to their new home until they're about between 7 and 9 weeks. We would certainly recommend that you get the first set of vaccines. We recommend that puppies get their first vaccination against parvo disease at 5 weeks, and then at 7 to 9, then we give the first puppy shot. So there is that little extra one in there that you get done before it goes. And we have special prices for people with litters of puppies, so you call and check that out. Next part of her question is, how long after having puppies does she need to wait to have the mother fixed? Great question, because absolutely you want to get that done before her next heat cycle. The next heat cycle after she weans puppies may be about 2 months away, give or take a couple weeks. What I would recommend, as soon as the mammary chain has dried up and the milk is gone, that's when I would schedule that surgery. So I hope that helps. Give us a call, 419-885-4421, if you have more questions. If you're looking at your older dog, and you look at them right in the eye, and you're looking at those loving eyes as you try to hold a treat for them, and you notice that it seems a little hazy in there. What that is called lenticular sclerosis. It's an aging change of the lens that, until it becomes extremely dense, does not affect the vision. It is not a precursor to a cataract, so it doesn't mean that your dog is getting cataracts. They have a different appearance in the dog eye, but lenticular sclerosis is a phenomenon that happens to every dog, and most of the time we start seeing it happen as they roll into their senior years. 8, 9, 10, somewhere in that ballpark, depending on the size of the dog. The smaller dog gets into their senior years a little bit later than a larger breed dog. There's a lot of concern with people as it relates to declawing their cats. And we've talked about why people declaw their cats and what can we do to make declawing safe and healthy and less painful for the animal and an acceptable procedure. And the bottom line there is adequate pain management. One of the things that we have seen is a condition called chronic pain syndrome in cats, and it invariably happens in cats that have not had adequate during, and after pain management, and they end up with some phantom pain, just like a person that might have an amputation might have some phantom pain. And it is fully treatable. It doesn't last a lifetime, but it must be addressed. And so I think the key is for you to select, if you're going to have your cat declawed, is for you to understand all the things that are done and why they're done that way. And for us, one of the major factors and one of the things that really cuts down a lot on chronic pain syndrome, because I just can't remember the last time we've ever seen it, is that we use our surgical laser to do that. It deadens the nerves. It prevents bleeding. We don't have to use a tourniquet. None of the things that are potentially really painful long term for the cat are there when we're using our surgical laser. Periodically, we get visits with a pregnant mom in the house who is mother-in-law or their mother has become concerned about the presence of a cat in the house. Possibility that the cat might transmit toxoplasmosis, which is a disease that cats can transmit, but so other animals can as well, including rodents, and it can be transmitted in raw and undercooked meats as well. But the cat, in order to transmit toxoplasma to the pregnant mom, must be having the disease, be what's known as febrile. Remember, we talked about what febrile meant an elevated temperature. They must be ill with the toxoplasma, and then they must be passing the eggs of the toxoplasma organism in their stools, and then the stool has to incubate for 48 hours before that egg can be infectious to people. And so toxoplasma is nothing to sneeze at because it can cause birth defects in children. But the answer is you don't need to get rid of your cat. You just need to use some common sense when it comes to cleaning the litter box. Clean it every day. Let somebody else in the house clean it. Just keep it thoroughly dumped, and you would not have a problem. I would highly recommend that you talk to your physician about that, find out their concerns, and you can actually have a blood level tested on yourself to find out if you've ever been exposed. I would also counsel you during pregnancy, don't eat raw and undercooked meats. Don't eat any of what are supposedly delicacies. I could never force myself to eat raw meat, including sushi. I just can't bring myself to do that. But those are things that are far bigger concerns as far as I'm concerned. A condition that occurs in cats with a lot of frequency and is frequently misdiagnosed as an infection is a condition called feline lower urinary tract disease. Feline lower urinary tract disease is triggered by stress. It's not triggered by infection. And yet the clinical signs are similar to what you would expect. And so it's important that when we see cats that go to the litter box repeatedly and sit and squat and pass little to no urine, that they're licking down in their vaginal or their penile area excessively, that there may be some blood in there. Sometimes they decide to go outside the box and you can go in the sink like they're trying to tell you that there's a problem, that we rule out urinary tract infection. But statistically, less than 1% of cats with signs of urinary tract inflammation actually have an infection. So the use of antibiotics in the treatment of feline lower urinary tract disease is basically and totally worthless and not something that we prescribe very often. But managing stress by using anti-stressing medications is the most critical factor. Well, we're going to take a break and we'll be back. Well, here we are back to wrap it up, and I'm going to talk about just a couple of things. Last week we talked about ear infections in dogs and what might cause them and how we go about treating them and what we use to help us make a proper diagnosis. And remember how important I think it is to get a proper diagnosis. But sometimes, in spite of our best efforts, ear infections they can't be managed, and ear canals become more and more damaged. They become scarred in, they swell shut, they're closed. Now they're closed up and they're truly painful. And that leads us to a condition that has to be done called a total ear canal ablation. So the acronym is TICA. And I've done a number of TICAs over the years, and I've always felt that they've really helped the animal because we're eliminating that chronic pain and chronic inflammation. And interestingly enough, there have been some studies that show that even animals that have had both ears had TICA procedures done on, those animals hear better than they did when they had their damaged ear canals. So they can still hear because we're not removing the inner ear. We're just removing the outer ear canal and opening up the middle ear to allow infection to be treated and medicines to get at that infection to treat that. So a TICA procedure, if your animal is in chronic ear pain, has closed up ear canals, and if they can no longer be managed medically, is something that I would strongly encourage you to consider. And I would be happy to do a consult with you on that. The other thing I want to do is acknowledge my sponsors, and so Sylvania Veterinary Hospital. We've been voted year after year as best vet, and the reason for that is that we really